WMEL.
That's the sound of the 1951 Ford Victoria Hot Rod, fully restored and donated from the private collection of A.J. Hires. It's the 2017 Win the Classic Ford Car Raffle to support Helping Seniors of Brevard. You have to see this car. I'm Kerry Fink, and I'm inviting you to visit helpingseniorsofbrevard.org for full information on this exciting car raffle. That's helpingseniorsofbrevard.org. Stay tuned for more info on the Talk to Me Radio Network. We're glad that WMEL cares about the state and Treasure Coast.
It's the Talk to Me Network on AM 1510, FM 99.9, 94.7, and 100.7. The views expressed on the following program are those of the hosts, callers, and guests, and are not necessarily those of WMEL staff, management, or advertisers.
Live with the Thursday edition of Helping Seniors, the radio arm of Helping Seniors of Brevard.org. That's our website, helpingseniorsofbrevard.org. And if you want to find out about anything that my panelist, Rob Graham, and I are talking about today, go to helpingseniorsofbrevard.org tomorrow night sometime, and we'll have this radio show archived on the network. You'll be able to listen to any part of it you want to listen to, as well as many, many other radio and television and newspaper articles that are archived on the website for your information and your education. But Helping Seniors was formed in 2011 to inform, educate, and connect seniors and those that care for seniors to resources. We took it as our job not to compete with anybody, because there was certainly nobody doing, and nor is there today anybody doing what we do, to try to publish a newsletter that's now picked up by 1,178 people that have asked to have the newsletter sent to them online. We have the readers are in the several hundred thousand now of all the different publications that we have columns and articles in, our radio and television shows, hometown news. But we're all just trying to help you better understand what is available to you through people that sponsor our organization and the many other organizations that you need to know about Brevard County. We advertise for everybody that helps seniors. That's our job. Our information specialist, Kate Kaiser, can be reached at 321-473-7770. And if you have a question about senior living, senior needs, anything like that, call Kay, because very often we find out that what you think you need might be what you really need, but you might need more. And that's the advantage of having somebody that works with a lot of seniors answer the phone, because sometimes we can pick up on things that you're not aware of, and you'd be surprised that we have over 75,000 veterans that live in Brevard County, Florida, and we continue to find daily many, many, many people that are not even aware of the Veterans Clinic, not aware of the fact that there are so many services available for veterans, and there's a lot going on recently about down in Palm Bay about the veteran services and how we spend our money. And the sad part about it is we don't always know the truth. And so today my panelist Rob Graham from CarePatrol is with me, and we're going to talk about CarePatrol, because you might be able to figure out what that is from the name, but after Rob talks about it today, I think that you'll be a lot better informed, because what's important, folks, is that the care system itself is changing, and it's going to have to change even more if we're going to care for the people that are going to need the types of care that in the future. The report came out this morning that if the Affordable Care Act is repealed, 32 million people will go on will lose their insurance. Now, if that's true or not, I don't know. It probably will be a large number of people, but that doesn't mean they won't pick up something someplace else. And the trouble is, when we start talking about all these numbers, we don't know the truth. And that's one of the things that Helping Seniors is try to do, is to give you information that's based on fact that is true. And we'll always try to do that. But having said that, let's talk today with Rob Graham, and welcome, Rob.
Hi, Joe. How are you?
I'm fine. I think I am. Sometimes people ask me that question, Rob. I have what some call fibromyalgia, along with other senior ailments. But heck, I never know how I'm going to feel from day to day. But if more of us learn to take it a day at a time and do the very best we can with whatever the good Lord gives us to do it with, that there are a lot of us that are here in Broward County that can help other people. And I think that's one of the things that I sense that organizations like CarePatrol are doing. And that's why it makes it a pleasure to have some of the changes I've seen personally in the care system in the last 20 years. I've been involved in actually close to 30 years. And I sense some of the programs like CarePatrol as being something that is new, different, and it's you probably have combined 3 or 4 organizations into one. And so how about just tell our listening audience, what is CarePatrol? What do you do?
Okay. CarePatrol has been around for 25 and a half years, started in the suburbs of Phoenix. And what our mission statement is to find the safest care options for our seniors across America. Now, CarePatrol in Brevard has been around since my wife and I purchased the business February of 2014. And what we do specifically is to help families locate either independent living, in-home care, memory care, assisted living for their loved ones. And we are a free resource to the community. We have a very, very comprehensive perspective of how we go about finding the right solution for that family's loved one. We do a very in-depth, what we call care discovery. And that is important because we have to understand what the specific care needs are for the individual who needs help. We don't want to mismatch care needs with care capabilities of an assisted living facility, for example. We also want to understand as best we can through the individual and the individual's family what that person's social acumen is. If someone, for example, is late stages of Alzheimer's, he or she may not be able to have a very vibrant social life just because of the disease and what it's done.
Right.
So we don't want to take that type of individual and recommend facilities that are much, much higher functioning because that would be a mismatch from a social point of view. Conversely, if someone just has perhaps some physical incapacity such as multiple sclerosis, but there's no cognitive degeneration whatsoever, we don't want to make a mistake and have a very high cognitive function individual matched with an environment that has later to end stages of a dementia where that their cognitive capability isn't the same. So that social piece is as important as the medical piece, the care piece. And then, of course, we talk to the families about financial capabilities, affordability, that is, try to help them understand where there is access to additional funding, such as the Veterans Aid and attendance benefit, how we might go about securing that money, as well as if there's a need if someone is indigent and they have lower than the $2,205 per month income, then they perhaps could qualify for long-term care Medicaid. So we do take a very holistic, comprehensive approach to the solution. We're always problem-solving, and we're problem-solving in real time. And that can be a tricky thing because if a family is all of a sudden, let's say, for example, a family's not local, and they come down, they see mom, dad, whomever, is all of a sudden has a refrigerator full of spoiled food, for example, expired medications in the medicine cabinet. That at times can be shocking to them because they didn't know it was happening. So they quickly have to speed up into fix-it mode and trying to navigate the waters of a very, very murky, if not muddy, system, care or healthcare system, and that can be challenging. So one of the benefits that we bring to the table is that we we can absolutely respond in real time. We can speed up, we can go as fast as a family needs us to go, or as slow as a family needs us to go. It's all about what they prefer and finding the right solution.
Okay. If I ask you the question, I said, Rob, could you tell me what type of organization in Brevard County comes closest to doing the type of work that you're doing? How would you answer that?
Well, look, anybody could open up, hang a shingle on their home and say, you know what we do? We help seniors find assisted living, for example. It doesn't cost any money for them to do that. They just need to get some marketing materials, and there's no licensing required, so out away they go. There are probably four other companies in the area in Brevard that do placement services. With all due respect to them, I don't think that they come anywhere near as close as to our capabilities. Keep in mind that we have a national presence. We have at this point 156 offices located in 40 states. So we in Brevard have helped families relocate a loved one from Brevard to Alabama, other counties within Florida, Tennessee, North Carolina, Ohio, Illinois, and New Jersey. So we're only able to do that because we have that breadth of a network throughout the country that we can rely on our colleagues, CarePatrol in those different states, and we connect the families after we've done, as I said, the care discovery, the social discovery, and the financial discovery. And it's a very powerful capability that we have to help families.
In 1993, we formed a liaison with Minneapolis Life Insurance of Minneapolis, Minnesota. Mm-hmm. And they gave me $10,000 to help start a network nationwide where we were doing the same type of thing that you're doing. And we were able to start doing that because at the time I happened to be the treasurer of the National Federation of Interfaith Volunteer Caregivers, which was an organization sponsored by the Robert Wood Johnson Foundation with over 2,000 chapters throughout the United States. And they helped form these little organizations, and we just we had a phone book, and if somebody needed help, we could call and get one of the national associations, little affiliates there that were just small church groups or small nonprofit organizations, but we found we could help a lot of people. But knowing that, I knew that we needed more. We needed to have something really solidly professional in place. Could do the things that you're talking about, because what I hear you're saying is that you can help a family that lives in New York that has a loved one that lives here, and you can work directly with them in New York, and you can monitor the progress of their loved one here in Brevard County for them. Is that one of the types of things that you do?
Sure. What happens is when we make a placement. So in other words, when we find the right solution for example, with assisted living, and the loved one is safely in that particular location, we are checking up on that individual at least 3 times in the first 30 days, just to make sure everything's going well. We report back to the family and so forth, because we take it to heart that this gets done the right and proper way. Beyond that, as far as checking in and so forth, there are companies out there that call themselves case management companies.
Right.
They will, for what I consider a fairly reasonable fee, they will help those individuals if bills have to be paid, errands run for the loved one, things of that nature. So they can pick up where it is that we leave off.
But you don't do that kind of thing.
We do not.
But what you do is you know about organizations that do things like that.
Correct.
That are the good business that you can recommend to the family that live outside of the county.
Sure.
What you bring to the table, Rob, in terms of the caregiving situation is an element of honesty, trust, and certainly professionalism, because of the roughly 140,000 businesses, whatever you want to call them here in Brevard County, that hold themselves out to be 1, 2, 3 mom and pop placement up to 150. How many of those things do you think you've been in and know yourself? Have you been in all of them?
Oh, good Lord. So in Brevard, depending upon the day of the week you ask, there are about 180 assisted living facilities. And when I say assisted living, that means independent living that's part of an assisted living,
Right.
memory care. So we have been into not every single one, but there's probably only a handful or two that we've not been into. Because frankly speaking, there are those that do not do a good job. The state finds out about it, and they have the authority to come in and shut that business down. And then what can happen is it gets opened up under another name. The whole business of assisted living, memory care, it is what I consider to be a very heavily regulated industry, which is a good thing.
It is good.
So, for example, the Agency for Healthcare Administration, or AHCA for short, is the regulatory body that governs assisted living for the state of Florida. And they conduct biennial inspections of all licensed assisted living facilities. And based upon what they find, they can give what are known as deficiencies. And those are ranked 1 through 4, 1 being the worst, 4 being more administrative in nature. They also have the power to levy fines, which happens, surprisingly so, fairly often.
Quite often. I know it does.
And they also, like I said before, they have the authority to shut a place down. There are a huge number. So let's actually play with numbers here for a moment. So when I said there's about 180 in Brevard County, so let's just use that number. Out of that 180, 83, 84 in that area are in Palm Bay alone. Now, of that 83 and 84 that are in Palm Bay, only 3 of them are larger facilities. The rest of them are residential, licensed for 5 or 6 people. So you really need to know how to navigate the labyrinth known as assisted living, because there are, Joe, I'm telling you, there are some excellent ones.
I know.
But there are some out there that, frankly speaking, you wouldn't want your worst friend in.
Yeah, they shouldn't be in the business. And
they should not be in the business.
I've come across them myself over the years, and I have reported some of these organizations to AHCA myself. I've done this, and because I think that if you're afraid, Rob, to call it like it really is, then you shouldn't be in the healthcare business. If you can't do what is right and take care of people, if you know an organization that doesn't exist or it exists, it's not good. You shouldn't be recommending those to anybody else.
People should understand that there is a huge difference between capability to care for people and willingness to care for people. Just because an assisted living facility is licensed by the state of Florida doesn't mean that they're going to be willing. That's entirely related to ownership and staff. And your loved one's happiness, safety, is entirely based upon the capabilities and willingness of the owner and staff. If you don't have that willingness, then we ought not to be going there. And I'll give you an example. There is a rather, no names involved, but there is a very large ALF, or assisted living facility in the county, that has a higher licensure capability. It's called a limited nursing services license, which allows them to do things that standard licensed facilities cannot do, such as they can manage insulin on a sliding scale basis. So if I had to go to assisted living, for example, and I, for whatever reason, could not or would not in other words, give myself the finger sticks and check my blood sugar, and then based upon what the blood sugar readout is, then I have to adjust the amount of insulin that I'll put into the syringe and then inject myself. If I'm either incapable or unwilling in doing that, standard licensed facilities really cannot do that for them. So you'd have to go to a limited nursing services licensed facility. So this one that I'm talking about, the individual that was looking at this place, that's what they needed. That's what they needed done. And the facility refused to do it. So those are the types of things that the public is not going to know how to navigate through that. Because think about it. If their loved one is in one of the hospitals here, and the hospital says, okay, case management calls the family and says, okay, your mom, she's ready for discharge. Then we're not doing anything more for her medically. She's cleared to be discharged. What's the plan? Families oftentimes can get a bit of a deer in the headlights look. Like, what do I do? Because I know that I can't take care of mom at home. What do I do? So that's how we can quarterback that whole situation. We work very, very closely with a number of the hospitals here in the county. We know the case management staff. We help the families get organized. We will make recommendations, send the recommendations to the family for them to review. We'll set up times for us to go tour those different assisted living facilities. We'll accompany them. And we, when necessary, will also negotiate pricing on their behalf as well.
Yeah. You made a comment earlier in the show, and we don't have a lot of time to talk about it. I want to talk about it more on the other side of the break. But you mentioned managed care and talk about helping people get. The state of Florida did away with the Medicaid managed care program a couple of years ago, but we still have this type of care that goes through 4, I think, home health agencies that. You know what I'm talking about?
It's called, yes. There is a state-funded Medicaid, long-term care Medicaid program, and there are a couple of spokes to that. You let me know when to be quiet when you can talk about it on the other end of the break. But the two pieces that are most commonly used are the access to Medicaid funding for in-home care, and the Medicaid access to funding for assisted living.
Let's talk about home care first. Okay. We'll talk about that, and then we'll pick up. Let's talk a little bit about it now. And make people stay with us on break.
Sure. So what happens is there has to be a medical evaluation done by the state, and they'll go in and look at the individual to validate that there's medical need for in-home care. Once that is accomplished, there's also a financial evaluation. Keep in mind that you can make no more than $2,205 per month in income, and you can have no more than $2,000 worth of qualified assets. Now, a lot of people can get tripped up on the term qualified assets. A qualified asset, what a qualified asset is not, is the primary residence. So if you are in your primary home, the one that's homesteaded, that does not count as an asset. It could be $1 million home, but it counts as nothing. And I guess that's our break.
Okay. We're okay. Keep going.
Okay. And there are so once that financial qualification happens, then it all gets brought together, and then it goes through the approval process. And in Florida, that can take 18 months, depending upon the environment in which that person is.
Bob, I'm going to cut you off. We're going to get into this. I want to make sure that people get this. But folks, we're running out of time. And stay with us, because what Bob is going to talk, or Rob is going to talk about on the other side of the break, is that it's something that you need to understand. It talks about Medicaid funding, and with the changes in the Affordable Health Care Act and everything, this is something you're going to need to be up on the step on. So stay with us so they can listen to Rob Graham, the owner of CarePatrol, talk about this after the break. Stay with us.
WMEL. That's the sound of the 1951 Ford Victoria Hot Rod, fully restored and donated from the private collection of A.J. Hires. It's the 2017 Win the Classic Ford car raffle to support Helping Seniors of Brevard. You have to see this car. I'm Kerry Fink, and I'm inviting you to visit helpingseniors.brevard.org for full information on this exciting car raffle. That's helpingseniors.brevard.org. Stay tuned for more info on the Talk to Me radio network. We're glad that WMEL cares about the space and Treasure Coast.
This is Joe Steckler, folks. We're back live with the second half of the show. Remember, the mission of Helping Seniors is to inform, educate, and connect seniors and those that care for seniors with resources here in Brevard County and resources outside the county if they're applicable in your case. You can do that by calling Kay Kaiser, our information specialist, at 321-473-7770. And remember that 2 weeks ago we started officially our raffle of the 1951 Ford Victoria hot rod that was given to us by A.J. Hires. That's right, folks, given to us. There were no strings attached except that A.J. asked us to sell the tickets, as many as we could, to help as many people as we could in Brevard County, Florida. And that's certainly a generous thing for him to do and for his dealerships to do. And we're having an event, AJ is having an event Saturday night, this coming Saturday night, at his Infinity store down on Apollo Boulevard. There'll be an ice cream truck there and be some other stuff there, and they're going to show off cars and do some other stuff. But our raffle car will be there at the Infinity store from 8 to 10 in the evening. We'll have our red tent out there with our donation tickets, and you have a chance to take some of the tickets if you want and help us pay for the cost of care here for people. That's how we pay our bills. We raise our own money. We're not dependent on the government. We're not dependent on anybody except you, our potential donors, to help us because it's the right thing to do. And we're going to be talking more about that. And we have an advocacy council for helping seniors, and I did some digging and found out that maybe we haven't been so smart here in the county after all, and we need to think about a senior services council, the same as we have a children's services council. And you'll be hearing more about that in the days to come, because if private citizens don't start working together to do the type of thing that Rob has done with his business about helping people and what other people are doing, we are not going to drive the cost of health care down, and we're certainly not going to be able to pay some of these staggering costs and keeping programs in place, especially if the county and United Way and everybody else keeps losing money and we don't fund programs, we take money away from nonprofits. We are going the wrong way, folks, and I'm trying my best to put this into articles that you'll read in Senior Scene magazine and in Hometown News, Spotlight magazine, Aldea Today, the Barefoot Bay Tatler. All the stories are in there. Everything is based on truth and fact, and it's not Joe Steckler's interpretation. It's a reading of the rules and reading of what's actually said and what's actually happening. So I would challenge you to show me if I'm wrong. I certainly will stand corrected and make sure people understand why I'm saying we need to correct things. But until you can show me that, we're going to go on the basis that we can do a better job of doing what we're not doing to help people. And I really, really mean that. And that's why I'm so pleased to have a guy like Rob on the show today, because CarePatrol, it's a case management type thing. It helps get people into the right element of care. And before we took the break, we were talking about Medicaid, and it's something that you really need to understand, folks. It's Medicaid, and Rob is going to talk a little bit more about it, because I want you to understand Medicaid, what it does, and this. We used to call it the diversion program, then it got called the Medicaid Managed Care Program, but there are still organizations in Florida that get federal money to help people get into the type of care that Rob is talking about today. So, Rob, please tell our listeners how just boil it down to these two types of funding and how you can help those people.
So, as we were talking before the break, there are two spokes to the long-term Medicaid. And in Florida, it's entirely state-funded. In other states, there is a federal subsidy associated with it as well. But in Florida, it's entirely state-funded. And given the fact that we live in a state that, well, think about it this way. There is no state income tax.
Right.
The budget is essentially funded from property taxes, the lottery, and gaming. So we also live in a state that has a higher proportion of seniors. That's just an accident waiting to happen as far as funding goes. And the way to access Medicaid, we talked a little bit about the qualification, the financial qualifications. And to recap, it's no more than $2,205 per month in income, no more than $2,000 worth of qualified assets. If you meet that litmus test, then you can apply for either in-home care Medicaid or the assisted living waiver, which used to be called diversion. Now it's assisted living waiver. In those instances, depending upon which Medicaid provider you choose, and there are 4 of them, AmeriCare, Coventry, Sunshine State, and United Health.
Yeah.
So depending upon which 4 you choose, they will provide a range of partial funding, not entire funding,
right,
for an in-home environment or an assisted living environment. On the other hand, if someone truly needs to be in nursing home care, they will, any one of those 4, once approved, the individual will receive virtually 100% funding from one of those 4 providers.
For nursing home care.
For nursing home care only. And so let's say someone makes $1,500 a month, and they qualify, they're approved for Medicaid. They call it Medicaid ICP, or the Institutional Care Program. That's the Medicaid that provides nursing home funding. The only thing that the individual needs to give up is he or she doesn't have to give up all $1,500. They get to keep $105 per month.
Let's say maybe their Social Security.
That's whatever income they have coming in,
right,
with the exception of Veterans Day and attendance. But if that's their Social Security, at $1,500, they have to give up $1,395 of it to that nursing home.
Right. So the nursing home would be providing assisted living for somebody for roughly $2,500 a month, $2,600.
No, the nursing homes are getting in the neighborhood of about $5,500 a month from one of those Medicaid providers.
That's for nursing home care.
That's for nursing home.
Now, how about assisted living?
Okay, so assisted living, there's a range in Brevard County of $950 to $1,100, again, depending upon which of the 4 the individual chooses.
Okay.
Per month towards assisted living, and it works the same way with in-home care as well.
So let's say if they pick an assisted living facility that's going to roughly, and you might find some for $3,500, but if you want all the frills, bells, and whistles, you're looking at $4,500 to $5,000 a month for assisted living care. Am I right or not?
Well, there's a fairly, you're pretty close. I mean, there's a range of pricing in the county.
Right.
I have seen it as low as, and I'm talking about licensed facilities.
Oh, yeah. Make it clear. We're talking licensed facilities.
Licensed with the state of Florida.
Oh, just licensed.
Yeah. So I've seen as low as $1,800, and I've seen as high as $6,500. Now, traditionally, let me explain this to everybody so they're crystal clear on this. Let's just talk about the larger facilities out there, okay? Not the residential homes that are licensed for 5 or 6 people, but the larger ones.
Larger.
Their pricing model is they charge room and board, okay? And then they will, based upon their own nurse's assessment of the individual, will charge what they call a level of care. Most of the time, not all the time, most of the time, these levels of care fall into 4, maybe 5 levels. Level 1 usually is included in the price of room and board, not always, but usually. And then level 2 through 4 or 5 usually starts at $300, $350 and goes up $300 per level, generally with a cap in care of anywhere from $1,200 to $1,500 per month, meaning that as long as the person is still eligible, appropriate for assisted living, even if they're total care, they can charge no more than that cap on care, which is $1,200 or $1,500, depending upon which assisted living facility. Now, you can imagine that if you walk into a larger assisted living and the room and board is, let's say, $3,500, well, that's without care. So that cost can creep up as the individual needs more care. And just to be clear, the way these assisted living facilities are evaluating the level of care and the costs associated with it, they are trying to do their best to understand how many hands-on labor hours are required for that individual's safety.
Okay.
If we're talking about simple queuing, like if I'm in assisted living, come on, Rob, it's time for dinner. What did that really cost the facility? Nothing. But if I, on the other hand, cannot safely get in the shower, and let's say I'm not able to rotate at my trunk to be able to wash my backside well, or I can't bend over and wash my feet, so I have to have someone physically doing that for me, that's where the costs can rise rather quickly. Let's say I have Parkinson's, and it's advanced in nature, and my tremors are such that even with a spoon, I cannot literally keep the food on my spoon. If they have to provide feeding assistance, that's another example of care costs. Anything to do with their activities of daily living. So we're talking about feeding, we're talking about bathing, toileting, grooming, dressing, all of that. Anytime there has to be human intervention, that's where the care costs are incurred. Now, let's go back to roughly 85 to 90% of the assisted living facilities in the county, which are these residential ALFs, the ones licensed for 5 or 6 people. They really don't have level of cares. They are, however, evaluating the individual as to how much care he or she will need. So I texted an owner this morning about a referral that I was going to send over to her for a tour next week. Her private room is $4,200. And she said it's $4,200 unless a high level of care. So then the question becomes, well, my goodness, what does that mean? What's the definition of high level of care? So when you go to the residential ALFs, I will say it's a little subjective as far as evaluating the level of care. But by and large, you're only talking a few $100s as opposed to the larger places where you can max out at $1,200 or $1,500 a month. Does that make sense?
Which all the more reason brings us back to the basic thought about how CarePatrol operates. It's your job to find out what these facilities can provide and at what cost they'll provide the services. A family comes to you, and you can sort of summarize very quickly for them the types of care and the costs they can get at different places. And a family could spend months going to different places trying to figure out things and how to solve problems, and still think they're going to be paying $3,500 a month and could be paying $4,500.
That's right.
And that's why, Rob, is so important, I think, for more as we get in advanced caregiving situations such as we're with people living longer and with more different types of medicine available to help people live longer. And we certainly want our loved ones to be as comfortable as they possibly can and to be cared for safely. It makes all the difference in the world about organizations like yours that can give this information to families not only that live here, but families that are long-term caregivers.
Oh, no doubt whatsoever. It really, I used the word before, labyrinth, and it really is a labyrinth out there. So I want to say something to those listening, and I don't mean to offend our partners, but people need to realize that assisted living is a business, just like CarePatrol is a business. Assisted living facilities are trying, not all of them, but many of them are trying to sell something. They're trying to sell their services. One of the benefits of using CarePatrol as an intermediary, someone to quarterback this whole thing, is that we're not really trying to sell anybody anything. We're trying to provide accurate information, the full picture, so families can make a well-informed choice on care choice for their loved one. We have some incredible assisted living partners in the community who, when they are not awarded, if you will, the placement, and the family chooses an alternate location, they say, we get it, as long as the family's happy, it was a good choice. We would have loved to have had them, but we understand the choice, and that's it. They don't get upset. They don't get hurt. They just continue along because they know that we know they do a great job care-wise, And we are, as long as they do that, we are going to continue to refer to assisted living facilities of that nature.
Yeah. And the other side of the coin, too, Rob, it's not fair to a family for them to be led on by a facility where they sort of get the family to become accustomed to maybe that they are going to be able to provide the service that they say they want, but when in actuality they're not going to do what they say what the family really expects.
Yes.
And this is something that you and just a very few organizations like you are able to do to help families navigate the care system. And I can remember years ago when I was the director of the Alzheimer's program, we had a package we used to send out. We used to check. We used to do what you do. We used to check the facilities. I knew all the directors at the different facilities, and we listed all of them by name and phone number. And if people, it used to cost us $2.73 to mail that package out to families. I'll never forget what the cost was, because that's what it was. But we send hundreds of those packages out every year to families so that they could at least get a head start on where to go and they get into the right element of care. But how do you when you get all these people, since you know the facilities, what they're capable of, you're able to assess what the family wants, and how do you decide what type of arrangement is going to fit those people?
Well, again, it goes back to the three things we talked about at the outset of the show. It really is entirely upon medical diagnoses, care needs, their social needs, and what their financial capabilities are. Now, there are times that if the family really likes assisted living facility XYZ, and it's, let's say, $300 or $400 out of their budget. There have been plenty of times that the assisted living facility, our partner, has been willing to discount and give them a break because they like the family. The family's active, they're engaged. The individual seems like he or she would be a really good fit for the community, the assisted living community, that is, and they're happy to have them. Now, does that happen all the time that we're able to get discounts? No, of course not. But many times we are in the right circumstances. So when you think about where we back up. So we use those three, the care discovery, the financial discovery, the social discovery. And then we talk about geographical preference.
Okay.
So if a family is local, and let's say the kids are in Merritt Island, we probably won't show or send referrals to them regarding Palm Bay assisted living facilities. Or conversely, if someone's in Palm Bay, we won't be sending Cocoa, Merritt Island, Rockledge, or Titusville options to them. So we try to keep that family unit close together, and then when we email those referrals to them, which have some pictures, they have some good information, there's some pricing on there, then the families are able to evaluate them, take their time with it, let us know when they would like to see these places, and then we'll go ahead and take it from there and schedule the tours. We'll accompany them, and then we'll talk about their choices afterwards. I can't tell you how many times a family has looked at me in the eye or leaned in the eye and said, "We can't choose, you choose." And we don't ever choose, but we then just take a step back and say, okay, let's talk about what mom needs.
Okay, and seeing that, one of the things I used to find a lot, and you haven't in the two television shows we didn't really talk about this aspect of I want to ask you right now. I think it's important that families need someone that when they're working with placement services like yours, I think that you all have a responsibility to tell the family that, hey, look, your mother and dad may not be able to completely afford to care out of their own pocket, but you got two brothers and two sisters, and if you all chip in a little bit, it's still a family's responsibility to help care for mom and dad.
Yeah, that's exactly right. Too many times. Remember that conversation about Medicaid a few minutes ago? Too many times, and I'm not, at the risk of sounding Pollyanna-ish, too many families rely on the government to subsidize when literally if there's 5 kids and each kid can throw in $50, that's $250. That could literally, no kidding, could be the difference between a safe discharge to a reputable, excellent assisted living facility or not.
But on the other hand, too, I think that from listening to the several shows with you, I don't think you would hesitate to point out to a family that there are things they could or should be doing if you felt it was in the best interest of both the care receiver and the caregiver. I think that's as important. But one of the things in the list of questions that I'd had from our television show, we never really talked about on TV, how do you help someone move closer to their family in another state? Can you do that? I think you probably can, by virtue of the fact that you're a national organization.
Yeah. As I said earlier, we've been successful locating assisted living for maybe a dozen folks or so out of state. Really, for us, it's not terribly difficult. All we need to do here locally is do all of the back work about those 3 discoveries we talked about, and get that information over to our colleague in whichever state or whichever other Florida county that they want mom or dad to come to. We contact our colleagues in that area directly. We have that conversation because we're the ones that have the benefit of having eyes on the patient.
Right.
They don't. So we talk them through all of that, and then at that point in time, the handoff is made from me to them, and they contact the family directly and then organize the search from their end.
Okay. I always talk to people about going to a good, reputable attorney, and the good ones, I say, don't charge you a consultation fee. They'll give you a free consultation. How can you explain to our listeners why they should not hesitate to call you? Because your services are quite affordable because you don't charge anything.
No, we don't. And to be very, in the spirit of being forthcoming, to my knowledge, the competitors that we have don't either. However, you ask the reason why they ought to be calling us, I'll answer. They call us because we're excellent at what we do, and we always have the safety of their loved one in mind, period, end of story.
Okay. We're out of time, and I want to thank you, Rob, for your very, very honest answers today because, folks, I don't know if you know it, but I know it because everything Rob has told us today is factual, is true, and you can take it to the bank with you. I remember years ago I did a radio show, and a guy named, I have a lot of respect for, Larry Brewer, said, you can take that to the bank with what Joe said that day. But you can do the same thing about what Rob said today. You can take it to the bank, folks. I'll be here next week to do another show with you. I'm not sure who my panelist is next week. But thank you, Rob, and I enjoyed having you here today.
It was awesome.
Thank you. Thank you for listeners for listening. Have a great weekend.